Okay, we are moving on to our next. Um, Let me finish this. Again, when you talk about ophthalmic formulation, here is used for local treatments. The major problems of ophthalmic administration is immediate loss of the dose by natural spillage. That means that almost 80% of, for example, if you put something like uh, an eyedropper within your eye, most of it spill off the eye. It's because of the sensitivity of the eye and the rapid tear turnover that occurs. And if you're doing multiple drops, you want to wait at least 5 minutes between the drops. Okay. Other things that you should be familiar with in relationship to ophthalmic formulation are ointments. Stay in contact with the eye longer than suspensions. That would make sense. Um, because of the viscosity, the greater viscosity of the ointment in relationship to this suspension. Many times of these ophthalmic formulations are made of mineral oils, white and white petroleum. Think about the petroleum generally. Um, Ointments can cause eye blurring, and many times it's suggested that because of this type of situation that are caused by the medication that is going into the eye, that they should be used at night when the individual is about to go to sleep. And each of the tubes contain approximately 3.5 grams of ointment within it. Other thing that you should know about ophthalmic formulation, that sometimes you can have the medication associated with the contact lens, such as hydrogel, contact lens. Um, Within those, the solution is placed within the lens, or the hydrogel associated with the contact lens and contains the drug, and then the lens are placed on the eye, and the drugs released into the eye area. You can have ocular inserts, dry solution fashioned as a film or rod that will go into the side of the eye, not into the eye, say, and they slowly dissolve as they absorb the tears. And there's certain definitions that you should be associated with, that you should be familiar with as it relates to the ophthalmic formulation. That includes conjunctiva, which is the eyelid lining, lacrimal caniculi, the gland that produces tears for the eyes. And anytime you see the word ophthalmic, that is related to the eye. And so, for example, we've been talking about ophthalmic formulations. That are formulations associated with the eye. Okay. Let's go ahead and begin to talk about intranasal formulation. Intranasal formulation. So when we talk about intranasal formulation, there are many different types. They could be associated with a drop or what's called inhalation. It could be sprays that sprayed into the nose, or it could be an aerosol. Aerosol is a spray and that's under pressure. There are many different type of reasons why an intranasal formulation would be best. For example, nasal congestion and allergic reactions, symptoms. Many times there are medication that take care of nasal congestion. They can get liquid that may be part of a cough medicine per se, but it takes a long time before it gets back to the nose and take care of the situation. And so something that's sprayed directly into the nose can be more effective. The nasal cavity holds about 20 milliliters and have a very rich blood supply. Okay, and can, for For example, when you talk about IV concentrations going to the vein, it happens very rapidly. Because of the rich blood supply that you find within the nasal cavity, getting medications to go through there can allow for similar drug concentration that you find associated with IV given medications. So the concentration can be the same within a very short period of time. Okay, so why does intranasal dosage get lost? Why are some challenges using the intranasal route to get certain formulations through that particular area? One, enzymes in mucosa may metabolize the drug, making it ineffective. The lower mucus flow that goes from the nasal cavity back down into the esophagus may remove the drug from being absorbed. And then there's only a certain amount of drug that can be shepherded through the nasal cavity. And because of that, intranasal formulation should not be used for very long periods of time. Okay, so let's look at some definitions that will help us to get a better understanding of what we're talking about in relationship to intranasal formulations. First of all, since we're talking about intranasal formulation, what are we talking about? We're talking about cavity, nasal cavity. So the location of the nasal cavity is found behind the nose and the roof of the mouth. And nasal cavity allows for the filtering of air, removes the movement of mucus. Many times that mucus contains a lot of dust that comes from that line. Again, protecting the air and cleansing the air for the most part as it goes down to the trachea, into the lungs. And so move mucus and inhale contaminants outwards and away from the lungs. Very, very important. Certain devices that can be used by putting medicine through the nasal cavity is a nasal inhaler. That is a device that contains a drug that is vaporized by inhalation. And of course, we talked about some of the components of the nasal cavity, such as the nasal mucosa. Nasal mucosa, again, allows for the movement of contaminants away from the respiratory system, can have enzymes that may render a particular medication less effective. And this nasal mucosa is the cellular lining of the cell. One of the things that you have here is what's called intranasal formulation. So inhalation dosages are intended to deliver drugs to the pulmonary system, the lungs. Gaseous or volatile anesthesia are the most important drugs administered via that route. You see that a lot of times in these medical television shows. They'll put a mask over a particular person, which allows the individual to lose consciousness. Most inhalation dosage form are MDI aerosols that depend on a powder of compressed or liquefied gas to expel the drug from the container. Another thing that's very important is particle size is a critical factor in inhalation dosage form. And the definition that we should be familiar with is that, remember, the goal of the inhalation formulation is to get the medication from the nasal cavity, from the dispenser of the medication into the lungs. And so we should know what alveolar sac is, or alveoli. And this small sac, a specialized tissue, allows for the transfer of oxygen out of the body, out of the inspired air into the blood, and then carbon dioxide that's coming from the cells to now diffuse into the alveoli and leave the body for exhalation. Very important process. Okay, so we talked about MDI over here. What does that mean? When we talk about MDI, we're talking about meter dose inhalation. And this delivers specially a specific measured dose with each activation. You have what's called nebulizers, creating mist when the stream of air flows over a liquid. And then you have discus. This is the administration of drugs to the lungs in a micronized powder. So 3 very important formulations that you should be familiar with: meter dose inhalation, and inhalers, nebulizers, and discuss. Okay, so again, looking at the term associated with MDI, metered dose inhalers. Okay, and you're looking at 2 different types over here, and other types over here. Here we have a tubular medicine that goes through the mouth into the lungs. Okay, but the main dispenser looks about the same. So MDI aerosols depend on the power of compressed or liquefied gas to expel the drug from the container. That goes in here and press down, and you have an expulsion of the drug into the mouth. Part of the size is very important. Smaller size is the best size that can fit within this type of formulation. And then there is a need of what's called spacers and adapters. What does that mean? Okay, so when we talk about spacers, first of all, we're talking about coordination that is required on the part of the patient between breathing and inspiration, and the actuation of the aerosol. Extender devices, spacers, have been developed to assist patients who cannot coordinate these two actions. The spacer goes between the mouth of the aerosol piece and the patient's mouth. The spacer allows for the patients to separate actuation of the aerosol from inhalation by 3 to 5 seconds. Very, very important. Again, allows for the breathing in of what has been exposed from the MDI aerosol, and an extension device can be very helpful in patients who cannot coordinate the 2 processes. Okay, so we are now going to the skin and look at dermal formulation. Okay. A few important points that I want to let you know. First of all, the skin is the largest and heaviest organ in the body, and basically the skin is 17% of the human's weight. Most dermal dosage forms are used for local effects on and within the skin. Dermal administration has a number of advantages, and these are very, very important in many different ways. What are some of the advantages that you find associated with these particular formulation? Well, their effects are local, so you have a local therapeutic effect. Their side effects are lower. Some of the challenges is that it may not be well absorbed in deep layers of the skin or mucous membrane, but can offer a steady level stream of drugs. Okay, so those are some things that are very, very important.